This video is going to demonstrate how to administer medication through an already established IV line, as well as just go over the basics of drop rate or flow rate. So the first thing that I would do is my patient already has an IV line established. So I would come over and I would introduce myself as the nurse. Good morning, my name is Jerica and I'm a student with Mohawk College. I would check their information against two forms of identification. So my patient obviously cannot talk, so I would check that their wristband. So Sloan Smith, date of birth, November 22nd, 2019. Excellent. The next thing that I would do is I would do my 3 checks for medication administration. So the first check would be when I get the medication out of the patient's drawer or the client's drawer to make sure that I have the proper medication. The second one would be at the computer against the MAR. So 500 milliliters of normal saline to be infused over 4 hours. And then the third check would be at the bedside beside the patient. So Sloan Smith, normal saline, 500 milliliters to be infused over 4 hours. So the first thing that I did was I calculated the flow rate, which I have all the calculations on my reintegration plan, which you can look at that after. So the 500 milliliters I calculated would have to be 125 milliliters through 1 drop of solution. Now the flow rate over that would be 42 drops over 1 minute per minute. So in order to get my thing primed, I would make sure the medication, I checked 500 milliliters, I checked the expiry date, color, clarity, integrity of the bag. It all looks okay. I'm going to check before I open it, I'm going to check my bag. It is a 20 drop. Make sure I've got the right one. Okay, I open that. I'm going to use aseptic technique, so I'm going to wash my hands, perform hand hygiene. And then the first thing that I'm going to do is I'm going to spike the bag. So for all intents and purposes, this spike, I would take off the cap. This is sterile, so I no need to sanitize that. So because it's sterile, I do not touch it. I would push it into the bag to spike the bag, get that going. Once that's there, it could start flowing. First things first, though, you want to make sure that the clamp is shut. All your clamps are shut. So that's going. Next, the drop chamber. You can see you just want to push it until it's about halfway, 3/4 of the way full. And then we are going to prime the line. So open the clamp. We're going to take this tubing off. Take the cap off the tubing and perform sterilization on that. Okay, then we're going to take that. We're going to open the roller clamp. Let it drip out into, right now I've just got it going into a glass. You can do it over a garbage can or a sink. We're just priming the line. So once we've got some of the solution coming out, close the clamp. We're going to check it, make sure that there are no bubbles in the line. If there are, you could just give it a couple flicks. The goal is to not give the patient an air embolism. All right, so we're going to set that up. Again, no bubbles, we're good. So this is capped again. We're going to check the IV site on the patient. Make sure that there's no edema, no redness, no moisture, none of that. Patient, it looks okay. So we're going to take the blue cap off the patient's IV site, the IV line. Make sure if there's a clamp there, make sure that that's open. We're going to sterilize. We're going to sterilize that line. Okay. 15 seconds. We're also going to do this one again. I would sterilize it again. This line sterilized, that's sterilized, and now there we go. So the patient is hooked up to this already. For most hospitals, they'll already have the gravity flow, so it goes automatically. You would just push it in, you know, 40 drops per minute. For me, you want to count, so you open it very slowly, and you would count 1 full minute, and to ensure that 40 drops are going through. So for the purpose of this video, so you're not standing there watching me count for 60 seconds, we're just going to make pretend. So 60 seconds, you count the drop rate, and you want 42 drops per minute. Once that's done, you're all set to go. And this whole bag will be infused over 4 hours. Before you leave, you want to tell your patient, I have a call bell over here if you need anything. If you roll over onto this, or if you get a kink in this, it might stop the IV, so try to keep it away. You want to usually the line's already on their non-dominant hand. And most patients don't want to play with it, but here we are. So we don't play with the line. Okay. And that's everything.